I'm Sharon Apperson. I'm a nurse practitioner. I work with Dr. Stout. And today we're talking about peripheral arterial disease, or commonly known as PAD. Arterial disease that traditionally most patients think about is where cholesterol plaque begins to form on the wall of the artery and over time then leads to a narrowing down or stenosis in that artery, limiting the blood flow in that artery. There's also things like, your aneurysms and other things that go along with arterial disease. But that's probably the biggest thing that people think about. The most common symptoms with PAD, or peripheral arterial disease, PAD is what you most commonly hear healthcare people call it, is when you go to walk, you get a cramping or pain. Sometimes it can be a heaviness or weakness in the legs. The most common place it happens is the calf. You can walk so far, the pain will get intense, you'll have to stop. And when you stop and rest, it resolves and then you can start walking again. As the disease progresses, which only about 20% of patients, it will progress past that lifestyle issue. It can turn into where you get pain in the foot at night when you're trying to sleep that wakes you up and makes you get out of bed. Or you'll develop a sore on the foot that doesn't heal. But that's the more severe, but the most common symptom is that pain, heaviness, weakness in the leg when you try to walk. Those who are most at risk for PAD are patients or folks who have family history. If you have a history of grandpa had a foot taken off because he developed gangrene, or if you're a smoker, then that's someone who really should get pre-screening even before any symptoms develop. And one of the things that we offer is a free screening. We call it an ABI screening, which is a basic test to see if there's any signs of PAD. For that group, it's a little more aggressive. For those who aren't diabetics, when they start noticing the problems with walking, that's when they should call, and they can get the free screening to see if they need to see us, or they can get an appointment and we'll do testing when they come in. And we'll do the testing to define what's going on, what degree, and then we'll go over treatment options for you, whether it might be some medication or an intervention such as an angiogram or exercise program, those sort of things. But that's what we would do first when you come to see us. And if you have any more questions or concerns about whether or not you may have PAD, just head to our website and there is a screening tool that you can fill out to help you figure out if you need to see us.